Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome back to my channel. As you know, I make videos about health and healthcare topics in simplified language so that you can understand. And all the information which I give you is directly referenced from US National Medical Library and is verified, authentic, and the most latest information in that topic. So today I'm going to talk about emergency contraception. Yes, so today we are going to talk about why and when, if ever, you need to do an emergency contraception, then what you should know about it, and what is the normal circumstances when you should use it or when you should not use it, what are the side effects, what are the effects, and when should you actually contact a doctor.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
Guys, emergency contraception is basically a birth control method which is intended to prevent pregnancy in women, obviously. And it can be used in various circumstances. For example, you can use it after sexual assault or rape, or you can use it if your condom breaks or a diaphragm slips out of place, or if you forgot to take your birth control pills, or if you had sex and you don't use any contraceptive method. In that cases you can use this. Or even if you do not use your contraceptive method correctly, birth control pills are not used correctly, in that case also these emergency contraceptive methods can be used. So what do you need to know about them? Emergency contraception most likely prevents pregnancy in the same way as regular birth control pills. So the actions effects are that it either prevents or delays the release of an egg from the woman's ovaries, or by preventing the sperm from fertilizing the egg, right? So there are two ways you may receive an emergency contraceptive: either by using a pill that contains a man-made synthetic form of the hormone progesterone. It's called progestins, right? This is the most common method used for emergency contraceptives, by using a progesterone or progestin, right? Or the second method is by having an IUD, intrauterine device, placed inside the uterus. So these are the two methods. Obviously you have the choice for which method to take an emergency contraceptive pills. And yes, two emergency contraceptive pills may be bought without a prescription. For example, there is a tablet which comes by the name of Plan B, one step. This is basically a single tablet. There are some which come by the name of Next Choice, which is a two dose tablet, and both pills can be taken at the same time or as separate doses 12 hours apart. And these, either of them, may be taken for up to 5 days after unprotected sex. There is something called as ELA, that is ulipristal acetate. Ulipristal acetate is basically a new type of emergency contraceptive pill, and you need to take a prescription for that from a healthcare provider. And ulipristal is basically taken as a single tablet, and it can be taken up to 5 days after unprotected intercourse. Then birth control pills can also be used. You need to talk to your doctor about the correct dosage in your case. In general, you must take 2 to 5 birth control pills at the same time to have the same protective effect. Obviously, as we talked about IUDs, as we already talked about IUD placement is another option, and it must be inserted by your gynecologist within 5 days of having unprotected sex. The IUD that is used The IUD that is used should contain a small amount of copper, and there is also an option to remove it after your next period, or you may choose to leave it in place and provide ongoing birth control for a long time. A woman of any age can buy a Plan B one step or a next choice tablet from a pharmacy. Now these are brands which are given in the US National Medical Library website, so they might not be available in India, and you might get a different brand here. You need to talk to your doctor, but basically they will have a progestin, but basically the main ingredient will be a hormone called progesterones, so you can look for that. So a woman of any age can buy these pills at a pharmacy without a prescription or a doctor's advice, without a prescription. Emergency contraceptions work best when you use it within the 24 hours window of having unprotected sex. However, it may still prevent pregnancy for up to 5 days after you had sex. You should not use emergency contraceptions if you think you have been pregnant for several days. If you think you are already pregnant for several days, then you should not use them. You can bleed out like anything. And if you have a vaginal bleeding for an unknown reason, then also you should not use them. Talk to your doctor first in both these situations. What are the side effects? Emergency contraceptions can cause side effects. Most of them are mild, but they can cause changes in the menstrual bleeding, headaches, fatigues, nausea and vomiting. So they can have side effects. After you use emergency contraceptions, the next menstrual cycle may start a little early or sometimes later than usual. So your menstrual flow may also be unusual, can be lighter, can be heavier. Most women get their next period within 7 days of the expected date. If you do not get your period within 3 weeks after taking the emergency contraceptive, you might be pregnant. So contact your doctor. This is not a 100% effective method. Sometimes emergency contraceptives do not work. However, research suggests that emergency contraceptives have no long-term effects on your pregnancy capabilities or the developing babies, so you can use it. Some important things which you also need to know is that you may be able to use emergency contraception even if you take birth control pills. Talk to your doctor, your provider about your options. Emergency contraception should not be used as a routine birth control method. No, it's not. It does not work as a routine birth control method. It will not work as well as the birth control pill. Birth control pills are much better in that way. So that is all about emergency contraceptives. There are various names which are given for these contraceptives. Sometimes they are called morning after pills, post-coital contraception, birth control emergency, family planning emergency contraceptives, etc., etc. So this is all about emergency contraceptives as per medical guidelines. I hope you enjoyed the video. So I hope you understood everything, and if you haven't, then you can talk to your gynecologist about any concerns. Specific products, you can talk to your gynecologist. Don't forget to check out our question answer channel called Dr.Education FAQs. In this channel, I give you detailed information. In that channel, I answer your queries. Daily 2 to 3 questions will be answered there. So don't forget to watch the video, and rest of the answers can be obtained by our weekly live session, which will be done on Sundays. So follow my channel for the specific timings of them. of the live session, and don't forget to subscribe and hit the bell icon to get notifications. So till next time, I'm Dr. Paramjeet. Those who don't know me, I'm a consultant physician and cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi NCR, and this is my channel. So do subscribe, hit the bell icon, and share the word to all your friends and colleagues. So I'll see you tomorrow, same time, same place. Stay connected, stay healthy.